Hello, I'm Dr. Carleigh Nesbit, and I'm a reproductive medicine specialist at Boston IVF in Bedford, New Hampshire. I'm here to talk to you today about how to optimize your natural fertility. And I think this is so important for us to be talking about because a lot of people just don't even know where to start when they want to start a family. So I'm hoping I can give you some helpful tips, dispel some of the common myths and misconceptions out there, and generally help you with the first steps of moving forward. One of the first things that's important is to get an awareness about your natural cycle. A lot of people find that use of apps on their phone can be really helpful for this. But basically, you're going to track when your period comes, and that can help you figure out the time you're ovulating so that you can concentrate your efforts to conceive around that. For an added layer of information, you can use something called ovulation predictor kits. Those are something you can get over the counter or online. There's a lot of different types out there. I tell my patients all the time more expensive or more complicated is not necessarily better. And you're pretty much going to get a similar level of information from whatever kit you choose. In somebody who has pretty regular monthly menstrual cycles, I tell them to start checking their kits around cycle day 10, so 10 days after their period starts, and check just once a day, every day until the test turns positive. Once it turns positive, you don't need to check anymore for that cycle, but you could check it again starting cycle day 10 on your next cycle to see when you ovulate that month. In terms of when you should be trying to get pregnant in relation to when you think you're ovulating, a common misconception is that you should concentrate your efforts after you've ovulated. And interestingly, your highest chances of success are if you're exposed to sperm before you ovulate. So, while you can try to get pregnant every other day, roughly, in the time you think you're ovulating, the most important days are the day your kit turns positive and a day or two after. One thing that is a common misconception as well is that people are told throughout their whole life that if they have unprotected sex, they'll probably get pregnant. But human reproduction is pretty inefficient. So, for every try at getting pregnant, at best, there's only a 20 to 25% chance. And so don't get discouraged if it takes more than one try when you're, paying attention to your cycles and timing intercourse appropriately. Lifestyle can be huge in terms of optimizing natural fertility. So, first, let's talk about diet, exercise, and weight. So, ideally, you would have a healthy, balanced diet and get most of your nutrients and vitamins from your diet rather than from things like supplements. In terms of exercise, regular exercise is a wonderful thing and can help with fertility. And however you're able to do that is great. There's so many ways to stay physically fit, and whatever works for you is the right answer for you. In terms of weight, we see that people who are above a healthy weight or below a healthy weight, both men and women, can have a harder time getting pregnant. And so, taking steps to really try to get within a healthy weight range is really critical. All that being said, it is impossible to be perfect all the time. And so, do the best you can. Any positive changes that you can make are going to make a huge difference, even if there's still room to improve. In terms of other things to consider, if you're a cigarette smoker, that can be really harmful to your reproduction as well as vaping. And so I would strongly encourage you to take steps towards cutting back and ultimately quitting those things. We also discourage use of recreational drugs, including marijuana, while you're trying to get pregnant because of impacts those can have on the health of the pregnancy and also your ability to get pregnant. Also, important to talk to your doctor about your medications. There are some medications that can be harmful in pregnancy or make it harder to get pregnant. And important to think about where you work or other places that you spend time, making sure that you're not getting any toxic exposures. And if you're at risk for that, trying to minimize that. Some of the most common myths and misconceptions about trying to get pregnant are that if you don't get the timing exactly right, it's not going to happen. And that is so not true. Sperm can survive in the female reproductive tract for up to 5 days. So if you're even close, this should be happening for you. The other thing I hear from people a lot is that they're actually using lubricants that can be harmful to sperm. So, any water based lubricant can hurt sperm and hurt your chances of getting pregnant. So, making sure if you're using lubricant that it is a sperm friendly lubricant. Some of the ones out there, like Conceivies and Pre-Seed, are safe, as well as some more natural products like coconut oil. The last thing that I get asked a lot is there anything I should be doing after sex to optimize my chances? And we have looked at it and we really haven't found that anything particular after sex is going to make you more or less likely to get pregnant. Question I get a lot is I'm trying to get pregnant on my own, and when should I get worried that it's not happening for me? And when should I talk to my doctor about it? So, first off, I really strongly believe anybody who is trying to get pregnant should talk to their doctor, either their primary care or their OBGYN, before they start trying, just to make sure that you're going into a pregnancy safe and healthy and have been offered all the appropriate screening that you should be offered before getting pregnant. That being said, if you're trying on your own and you're under age 35, we recommend trying for at least a year before you start getting worried. And the reason is because most people will be able to get pregnant on their own within a year. If you're over age 35, then we recommend being seen a little sooner. So, anytime after the 6 month mark after you start trying. And that's because it can be harder for women in their mid to late 30s and especially early 40s to get pregnant. That being said, if you are worried at all, if you have any sort of concerns about your fertility, it is never wrong to talk to your doctor early and often about it. It's also never wrong to have a conversation with a fertility specialist, like all of us here at Boston IVF, because sometimes it makes sense to check things out and offer treatment before you've been trying for 6 months to a year. So, some examples would be if your cycles aren't regular or you're not getting a period at all, absolutely talk to your doctor. Or if you have any risk factors for infertility, like endometriosis, prior pelvic surgeries, prior chemotherapy or radiation, both for men and women, let your doctor know, and it might make sense to see us sooner. Anyway, best of luck, and we're here to help you if you need it.